Hi. So thank you for um, returning to my channel, and my name is Mariah. Today we're going to discuss healthcare systems. I posted some information about healthcare systems on my Twitter, and it's a video basically explaining very well some animation on different healthcare systems. And when I talk about healthcare systems, if you're not familiar on what that means, it means a mixture, not healthcare insurances like HMOs or PPOs or EPOs or anything like that we have in the US. Gets really complicated, but I'm talking about single payer healthcare systems, mixed systems like ours, where we have Medicaid, Medicare, private, and sort of universal healthcare systems, and then also and then another private insurance, another private system through the Affordable Care Act. That's what I meant to say. And then other universal coverages in different countries. So I'm just going to talk to you about a few different countries and their systems and our system, and basically you can make an informed decision on what healthcare system appeals to you, which one you think you would pick. So here I go. So the first one I wrote about was a single payer healthcare system, which a few examples of that Canada and Britain have. Canada's government finances their healthcare insurance, about 70% of it, and the private sector delivers the care. Britain, or the UK, the government covers about 80% of their insurance, but most services are free for their citizens. And the population, the individual there has about 10% of them buy private insurance. So I would say Canada's like their system is like Medicare, pretty much, like the U.S. is Medicare, and Britain is similar to the veterans, the VA's insurance. So then we're gonna go to mixed systems, where U.S. is one of the mixed systems. We have, again, like I said, single payer plans like Medicare and Medicaid, and then we have private ones through our employers and also through the Affordable Care Act. But for us, we still have a ton of individuals in the U.S. that have no health insurance. So that's a big issue for us, obviously. Another country that is similar to ours, well, yeah, and basically similar to ours, where they have a mixed system, is Singapore. And for them, they have basic care through the government, their government-run hospitals. Either the pay is very cheap or it's free, so you can get basic care through the hospital. They have mandated savings, which means that about 37% of their wages is taken automatically out of their 37% of their wages is taken from their paycheck, basically. It contributes to healthcare, housing, insurance, investments, education. And also their employer contributes a good amount too. But this is something that they can't change as far as like of right now. But this is how their system runs. So they have a mixed mandated savings system, and also a free, almost free government run system. Next, we'll go to universal coverage. A country that has universal coverage, or Yeah, that has universal coverage would be Australia, and Australia's coverage is they have free inpatient care in their public hospitals. They have nearly free medical services and prescription coverage. All of this is covered by their taxes, so I'm pretty sure their taxes are fairly high if it's going through that. They have voluntary private insurances, which offers a little bit extra services than the publicly offered ones. But the government for the private one pays up to 85% of the insurance. Another country that that has a universal coverage would be Switzerland. Switzerland, their universal coverage is not tax based, and it's not financed by their employers. It's actually paid by the individual. So how it works is that it's almost similar, I guess, to Singapore, where they pay into to having the insurance, but they receive quality care, and they receive access to care very easily. But this can also be contributed to their system, their wages in general. So I'm not sure if you know, Switzerland has been known to pay decently fair wages to their individuals or their citizens there. So paying into the insurance wouldn't be a huge issue, but it is very high. The GDP, which is the gross domestic product, basically meaning how much they spend on health insurance. Their healthcare system is just as high as the United States. It's the second highest. So they spend a lot on their healthcare there. And it's really competitive, and it's heavily regulated by private systems. So meaning that because it's not tax-based or not financed by employers, that means government's not involved. So the private systems are the ones that control, like private insurers control their healthcare coverage. And so because the individuals are buying into the private systems, that's why it's heavily regulated by private systems, because they're paying into it. It's not government regulated. So government's not taking any money out of their paychecks to pay for insurance, but everybody has insurance. So something's working. And also too, for Switzerland, their healthcare coverage, their healthcare to buy into the insurance is reasonable, even though it's high, even though it's technically high. If they have to pay for stuff that's out of pocket, the downfall is that that's extremely high. So another downfall could be that some services that a person may need may not fall within the like in the services that they'll pay for, the private systems. So if they have to pay out of pocket, that might be some difficulty. So I gave you a few systems to think about, different countries to look into with their health care system. So again, it was single payer, mixed systems, and universal coverages. And the mixed systems, it's a mix of private and single payer healthcare systems, and some mandated savings. So I guess government taking out not taxes, but an additional percentage from people's paychecks. So it's very confusing. Again, I will post another video or yeah, I'll post another video on my wall so you guys can see it. I'll post it on this wall on my channel, and then I will post it on my Twitter so you can understand, again, the different forms of healthcare systems and choose which one appeals to you. And that way, when we're talking about healthcare on TV for the U.S., you can lobby or petition for a healthcare system that you feel would be work best for you. So I hope this helps. All right. Have a good day. Bye.